right, well, good afternoon, everybody. Welcome to a weekly conversation. My name is David Sturtz, again with Cooperative Strategies, and speaking again today with Jeff Vincent from the Center for Cities and Schools at UC Berkeley. Jeff is a frequent partner in crime with Mary Filardo on assessing and writing and analyzing school conditions nationwide, and is a real advocate for healthy schools holistically across the country, and was an advisor, ad hoc advisor to the NASEM committee as well. So we are going to speak through with Jeff, and he's going to talk through some of the recent work that he and his team has compiled just this month on some resources for reopening schools, a one-stop shop of sorts for several different types of information. We're going to end with, as mentioned in email, some of you may have gotten about just having a little roundtable discussion about bringing more public awareness to the challenging condition issues that we're facing, as Jeff is going to speak to, his conviction on how condition is really impacting and impeding our reopening, and will continue. That will be borne out here in the coming months. So if you don't mind muting as you enter, we will, as always, please use the chat box for comments, questions as we go. We will address them, field them throughout the presentation, and which is really more of a discussion. So I'll stop talking, and Jeff, welcome back. Thanks for being here.
Yeah, thanks, David. Hi, everyone. I don't know, David, do you want to put it in presentation mode, maybe?
Yeah, doing that now.
So it's,
yep.
Okay. Okay, yeah, good morning. Well, I guess good midday. It's noon here in California, although it's, still, I'm looking out the window, it's still incredibly smoky and dark, but nowhere near as bad as it was yesterday. Although ironically in Berkeley, the air quality is actually worse today than it was for those horrendous pictures I'm sure you all saw yesterday. And that's only because yesterday we had a thick marine layer, because we're so close to the ocean. It was kind of pushing the smoke up and creating this like incredibly dark ceiling. And so I don't know, now I think there's been more mixing of the smoke and the marine layer, so that some of that smoke is able to come down. Anyway, it's terrible. So it's like all the children and sports teams that were trying to practice a little bit outside or have classrooms outside now, of course, can't do so because of this. But anyway,
wow.
yes, it's like, what, I'm not even going to ask what else can happen. But anyway, what I was happy to do and come speak about is some of the work that myself and my colleagues here at UC Berkeley have been compiling and doing on school facilities as it relates to COVID mitigations, when they do reopen. And I realize some of you have physically reopened. I mean, for the most part, with the exception of very few schools in California have yet to open or invite students back physically. And those of us who know our work at Berkeley, we have, we're mostly made up of education policy folks and kind of urban planning, built environment folks, looking at using a strong equity lens to look at the way in which places structure success for obstacles for children and families. And we've had a specific focus on the place of schools, public schools, their campuses and facilities for many years. And as David said, has been very concerned about too many subpar or poor quality conditions. And what we've been doing is trying to make that case, that connection to, reopening and mitigation. So what I'm hoping is that, we can also have a conversation here today, and I'll try to be brief, but I think those of you in the field are, as you're trying to figure stuff out, you're developing tools and resources that, can and should be shared probably widely than they are being used. But what we have done here is compile these together that we've seen, and this is a living compilation, so feel free to send us more. But I want to go to the next slide, David. And so what I wanted to do was just kind of do a quick run through of what we've seen and pulled together, and this is really sort of tools and specific knowledge that is specific to facilities, and in particular everything else besides cleaning. There's an enormous amount of information on cleaning, and I'll circle back to that in a second. But you can get this list on our website. But I do want to make a quick caveat. Just as I am not a smoke and atmospherical scientist, I am also not a virus scientist, nor and all that. But I have spent many months now listening to these people who are, following them diligently on Twitter, watching their presentations, having conversations with them, and reading the science that is coming out on this, which of course is every day. It's like, you know, as my friend Mary said to me today, she said, as you were getting hit with the fire hose, you were actually able to swallow a little bit of it. And so what I'm hoping to do is regurgitate isn't the right word, but help you see a little bit of what I've swallowed, I guess would be the thing. So we've put these things together, and I'm going to do a quick overview of those things, some of which I'm sure you all have seen, some of which you haven't, perhaps. And I would love to hear about what do you still need, because we'll look for it or figure out who can start developing it, or maybe you've seen other stuff that we're not seeing and that we can share with others. So next slide. And I assume everyone can hear me. Nobody's waving or anything. So
yeah, you're good.
Okay, and so you know, I'll start out by briefly saying that in addition to launching this, we just put out a new kind of short policy brief on school facilities and COVID mitigation. And what was occurring to me sitting on the National Academies of Sciences working group and you know, being involved in all these sort of local, state, and national discussions around this is that there was kind of a disconnect between the mitigation measures and the facilities specific related to those mitigation measures. And I think some of that, there's been a breakthrough on the ventilation stuff, which I'll speak to, and I'm sure many of you are working diligently to figure out. But really wanted to make the case more concretely that school facilities, you know, are on the front line of defense and reducing risk as we go back to school. And I think that, you know, the general public doesn't necessarily know sort of the uneven conditions or the differences in conditions of school facilities, whether it's around their HVAC systems or just their cleanliness or other pieces and things. You know, I mean, you have to have enough sinks, right, to do the level of hand washing that folks are talking about. It's much easier to clean surfaces that are in good repair and not falling apart than those that aren't in good repair, right? And on down the list, right? It's much easier to put a MERV 13 filter in an HVAC system that actually can fit a MERV 13 filter, some of which don't. And trying to understand those things. But what we do is articulate the science as it relates to why we're doing the mitigation measures. So go to the next slide. And so, you know, in this piece, and I need to like put a big op-ed or something in the New York Times or Washington Post on this, and hopefully that will happen soon. But basically that the physical conditions and qualities of school facilities greatly shape each school's ability to effectively implement COVID-19 mitigation measures. And the mitigation measures require facilities in good repair. You know, because as I read all the state guidance, it's sort of, there's an assumption that all facilities are the same embedded in those. And that's starting to change a little bit, but that was a big concern of mine, you know, even a month ago, let alone, you know, 2 or 3 months ago. And so, okay, next slide. So when we look at, you know, the paper lays out, it's short paper, I think it's 10 pages. So it's written in a sort of bulleted way so folks, you know, non-scientists could read it, or parents or school leaders, whomever. But what do we know about how the virus spreads and what it means for risk mitigation in schools? And where the science has coalesced is around, there's 3 main transmission routes. 1 is surface, 2 is direct human contact and droplet. Right. So if you were right in front of me and I'm talking, you know, I'm spraying you. We've learned a lot more about how much is actually coming out of our mouth when we're talking or singing than we did, you know, 6 or 8 months ago. And then the third being aerosol particles. And what's interesting about this is that, you know, in the first months of trying to figure out how we cope and live in a pandemic world, and a lot of the state guidance is really focused on number 1 and number 2. And the science on this has actually inverted and reversed, and I want to talk a little bit about that. So go to the next slide. this is a graphic that's in the report that it was pulled from another paper on viruses, but essentially there's a handful of these out now, which basically are articulating the difference or what those three mitigation or transmission routes are, right? So you've got large droplets, and then you've got aerosols, which are small droplets, and the scientists, you know, are trying to draw lines around, you know, the size of the virus particles and the size of the droplets, and there's some starting to be some consensus around that, and also with the terminology of it. But largely, but by and large, it's kind of like droplets, which are larger, you know, larger droplets of water, and then aerosols, which can float for more periods of time, particularly in indoor environments that have low ventilation rates. And then both of those things, droplets and aerosols, can fall onto surfaces. And the technical term for a surface, contaminated surface with virus particles, is a fomite, right? And so helping folks understand that those are the reasons we're doing the various mitigation measures is really important. And this is all described in much more detail in the report and with citations and all this. But if you go to the next slide, you can see that trying to understand, okay, what are the main mitigation measures that we're all trying to do in schools on the left-hand column? And then how are those addressing the three main transmission pathways? And you can see what we've done here is try to very simply articulate that. And perhaps this would be helpful both in thinking with your own kind of internal like facility staff, but also with school leadership and parents to try to understand how that works. Because what I have been very concerned about is schools are they have limited time, they have limited budgets, they have limited personnel. They, as you know, you need to be doing things that are having sort of the most bang for the buck or giving you the most protection. And so the science is getting more conclusive on what that is, but we don't know exactly for sure how much transmission is happening by these different routes, and particularly in different contexts, right? A school context versus an airport versus a hospital or something like that, or a shopping mall, for example.
Or a music room versus a kindergarten room versus a
right, you could drill down
room.
within a school. There would probably be a different sort of risk factors or different transmission possibilities or likelihoods of different types of rooms, depending on, say, the activity, as you're suggesting, right, David, which I think is right. And so some of these tools actually, I think, will get at a little bit of that. So go to the next slide. So what I have been fascinated with is that our understanding of transmission is evolving. And so, as I mentioned earlier, all the early state guidance and everything was really focused on cleaning surfaces and standing 6 feet apart, right, to reduce both surface transmission and direct contact transmission. And I don't know, I'm sure most of you are doing HVAC work now, so you've at least somewhat followed the big push on indoor air quality. But nearly 250 scientists, now it's been a month and a half or so ago, wrote a letter, it's in the New York Times, but they wrote a letter to the WHO saying that this virus is airborne. It travels in aerosols, that is very small droplets that can float and be sustained in the air for a period of time, and it is most dangerous or risky in indoor environments with lots of people where there's very poor fresh air ventilation. And why that was so, had been such a huge issue was because there had been, and there still is, but there had been some resistance to an acceptance that this was sort of airborne. I mean, nobody wanted it to be airborne, for one, right? But studying the travel of virus, whether it can travel, for one, in aerosols, and then, I mean, that's one thing, right? A whole other thing is, can it actually transfer to the body through aerosol transmission? And now there are a growing number of studies that do in fact show that yes, it's likely that it can. And so this pie that I made actually this morning comes from one of the leading scientists on this, Jose Luis Jimenez at the University of Colorado Boulder, who I'll talk about it later in this talk. His latest estimate from looking at all the literature on this is that this is what his guess is for what is happening along how much transmission is happening along these three main routes. And he's saying 3/4 of it is aerosols at this point, and around 20% is surfaces and direct contact. And then he's attributing a small percentage, 5 to ballistic droplets. This is where, in his definition, it's like, I accidentally sneeze on you or something like that, or I cough right on you, right? So, but the point is that this is inverted from where our focus was, and particularly where a lot of the state guidance focus was, 2 months ago, or, in the late spring, as we were trying to figure out how to reopen schools and battle, the expansion of this virus. And so, it's not to say that we shouldn't be cleaning surfaces or that we should be getting closer than 6 feet. We certainly shouldn't. Masks play a role in that, but
I mean, to me, it's just cleaner, but at 1/4. But if we want to stick with what we're doing, I'm fine with it.
If you don't mind muting, if you're talking right now, sorry. Go ahead.
So, but anyway, what's interesting is to look at this and then compare that to the guidance that is out there, because what I have seen, and I did sit on the California Department of Ed's, one of their task forces on health and safety, and our experience at that time, which that was back in May and June, the actual text that came out was inverted from what this pie shows. And so I think we've come a long way, but we have a lot farther, I think, to go, and we'll get to HVAC in a second. So next slide, please.
Whoop.
So this is what was the next slide?
Hold on. That one.
Yeah, so next slide. So here's a graphic that Lindsay Marr, an aerosol and virus specialist at Virginia Tech, did to really show, the large droplets when people are talking close range, and then the smaller ones floating in the air are the aerosols. And then this is from a presentation she did on August 26th to the National Academies of Sciences Environmental Health Initiative, which is recorded and very good. Her Aerosol Science 101 is a fascinating, 49-minute presentation. But anyway, they're finding evidence too that as aerosols build up in poorly ventilated rooms, that they fall onto the floor, become a surface contaminant, but that they can actually be kicked up and resuspended into the air by walking through it.
Yeah.
None of these things are things anyone wants to hear are realities, but people are studying this. What they don't know yet is, can those things be kicked up and then actually connect into someone's body and take hold? And that's the next piece. But again, in cleaning, are we focusing on cleaning of the floors, right? There's a relationship between the need to do that and the amount of ventilation, right? So next slide. So let me jump to, I want to be mindful of time. Let me jump to the resources that we've pulled together. And I want to say that most of these have been created by other folks who I am, touting their good work, sharing their usefulness. And, some people who may be involved in some of these are actually on the call, and I would welcome you to chime in the chat. So I'm going to run through these quickly, but hopefully they will be of use. For one, Paul Mills, who I think is probably on this call, he's been on some of them at Canon Design, came up with this really lovely classroom capacity calculator, which you can plug in your own numbers for length and width of room, and give you different scenarios of spacing out, right? And so you plug in all these yourself. If you go to the next slide, I have to commend him on this. It's an elegant online tool. But what it does,
pretty good with Excel.
Exactly. He's really damn good with Excel. But what it does is it shows you different scenarios with different size rooms. And, he's even plotting it out. So you get like an average students per classroom for different types based on the amount of distance that you want to incorporate. And so, I've seen a few of these, and states have come up with these, but this is one of the more elegant ones that I've seen in terms of being able to just go in and on the fly change stuff. And so and again, there are links to all of these things on our website on the page, which will have the URL up in a sec. Okay, go to the next one. And I'm trying to sort of use a New York voice to try to get through this so we don't run out of time. On aerosol transmission, the handful of leading scientists, who I'll provide the names later on a future slide, have put together a number of resources, one of which is this living document, Frequently Asked Questions on Protecting Yourself from COVID-19 Aerosol Transmission. It's a long Google document. That's the thing with all these. Most of them are Google documents or whatever, so that they're living, they can be updated, as well as downloaded and utilized and customized. In this group, Lauren Ansel Myers from Texas was on a week or two ago, and there were questions about air exchanges per hour and all of those things. Like her, I am not an expert in those things, but there are specific recommendations and enumerations here in this document. I just grabbed a screenshot of how to quantify the ventilation in a space, and I'll talk about another tool to do that in a second. But anyway, in terms of just simple understanding, what I rapidly went through on the last couple of slides in terms of like the science on aerosol transmission and accumulation in a poorly ventilated space, this FAQ is phenomenal. It is phenomenal. So next slide.
Are we going to come back to this one? Because if
we
time
certainly
permits,
could.
Jeff, I think.
Yeah, we certainly
I think
could.
this is one of those like key tools, which is how much air do I need to clean per hour,
right,
based on the size, based on the number
we'll
of
get to
participants.
that. Yes.
Yeah.
We'll
Okay.
get to that.
Cool.
So keep going. So this is something, this is a tool developed by Jose Jimenez, again, at University of Colorado, and some other colleagues. But this is, again, a Google Sheet that is an aerosol transmission estimator, and in different types of rooms. And I've only grabbed a screenshot of part of it. But again, a very simple, elegant thing that allows you, in orange, put in the inputs. Here you've got, the volume of the room, length, width, and height. It uses the enumerators to then calculate different things based on that, different transmission estimates based on where the science is, right? So he's continually updating that if something changed in our knowledge of, the emitters or whatnot, relative to the number of people or the size of a room. But what you get to at the bottom, I can't see it because I've got ventilation rate per person. So you can actually estimate the ventilation rate in a room. And there's a few tabs on this one as well that go into a little bit more detail. But what's beautiful about a lot of this work that's being done is that they're not necessarily made for, they're kind of made for you and I, right? They're not necessarily made for someone who's, got a master's degree in HVAC technicianery, whatever the word would be, and that's what I think is really nice. So even if a teacher wanted to pick this up and work with his or her students on this, for that matter, let alone school leadership, they could do so, or a parent. And I think that's, again, part of the beauty of this. But again, this is downloadable, customizable. You can add in, how much air is coming in, or is anyone wearing masks? And it comes up with a risk factor related to that. So go to the next one.
Wow.
So again, on HVAC, lots of good work out there. Another one I'll point you to is some folks here in California at the University of California, Davis. Teresa, how do you say your last name? Pistaccini, I believe it is. Really, really knowledgeable about HVAC systems in different buildings. They put together a short explainer video of ventilation in schools as it relates to COVID. I think it's 4 or 5 minutes. Definitely children could watch it, as well as parents and others. They have put together a report on how to test, adjust, and balance HVAC systems, and how to do that. It's fairly technical, but it's definitely readable by someone who has some understanding of that. And they also put together a proposal for a state level ventilation and energy efficiency verification and repair program that would target COVID reopening. And actually, there is a bill in the California legislature, which is going to the governor's desk as of, I think, yesterday, to be signed. That is literally the program that they proposed. So anyone working in state policy on this should take a look at that. And then again, here in California on the bottom, the Coalition for Adequate School Housing, which is a group of school districts and then private sector firms and others, unions and such, who do work on school facility issues in California. Their maintenance network put together in collaboration with the UC Davis folks, a really good resource on cleaning, disinfecting, and air quality. And there's a big focus on ventilation, how to fix ventilation and check ventilation. And I think what people are struggling with clearly is the great variety of ventilation systems across schools and even across individual campuses. Certainly we're dealing with that in California. So these are two good resources. Again, go to the next slide.
And Jeff, if I can interject, if you don't mind, like these resources, like these videos and so forth, these are all on the website that you should link for.
Yeah, so I did not put the URLs on this, but it's on I have our URL on the last slide. I had it on the front slide. Someone can put it in the chat here.
We'll put it in the chat when we get there. And those, there's no issues with schools linking to those, using those. It's all have at it.
All of these things are freely available, freely downloadable, that have been created.
Awesome.
Most of them are from public or partnerships of public-private for the most part.
And then one final question that came up in the chat I wanted to get to when we had a quick moment, and that was that for me, the novel concept of disturbing the layer of virus maybe off the floor. And the question that came up in the chat is it known whether or not that's any different for the common flu, the influenza virus? Is this particular to COVID, or is it, I would imagine it just has to do with particle size, but not my science.
Yeah, that's a really good question. I think that a lot of the science on this is being framed and driven by what they know about regular flu virus particles. I don't know the exact answer to that, but I think my understanding is that yes, it's possible. But I could look into that, but I'll point you to who is leading the front on that later in this.
Awesome.
So next slide. So I'm sure most of you are familiar with the very good work that is going on at the Harvard T.H. Chan School of Public Health, the Healthy Buildings program led by Joseph Allen. These folks have, these are building technicians, and they've been doing work on healthy buildings for many years, but they have done a yeoman's work on putting together resources that translate, particularly on ventilation, what do we know about acceptable air exchange rates? What do we know about levels of CO2 and stuff? And so they've done it in a very user-friendly way. And so their website, again, I didn't drop the URLs in here, but they're all on our site. They've done a couple reports. They've done a stuff for, directed at parents. The next two things on here, these two tools, I put them on the next slide. So why don't you just move forward to the next slide. So folks asked about checking ventilation rates. They also put together a report that really is a 5-step guide to checking ventilation rates in classrooms. And it's again, very simple, relatively so. I mean, air exchanges is not necessarily simple. But that being said, it's doable by, I think, your kind of average person to figure out, but it's around, measuring the dimensions, doing audio and visual checks, and then measuring the amount of ventilation. And then they compare that. What they do is they provide the targets of sort of risk that people are trying to get to. And so again, it's a very usable tool to do that. It's very similar to the one I showed before. And I should say that these folks are all collaborating together. It's interesting, and I have their names up, later. Go to the next slide. Part of that tool is everyone was asking about portable air cleaners. The Harvard folks working with a couple of folks at University of Colorado Boulder put together this calculator. Again, it's in Google Sheets. How big is the room? How tall are the ceilings? But to understand, do you need additional ventilation or additional air purifiers because your ventilation is poor or low? And how much air purification you need to sort of make up for that, right? So what this does is it calculates total air exchanges. And you can see it's got a sort of rating here of ideal all the way down to low. And then, what it does is it tells you like what size room will work for the portable air cleaners. And it provides some information on the sort of capacity of these units that you can buy, right, that are on the market. Again, that is not my expertise, but this has been a big question, right? Particularly in school buildings or classrooms that, the windows don't open very much or not at all, or the HVAC is at minimal at best. And so this is helping folks understand. And again, I think a simple, relatively simple and elegant way, because getting one's head around any of this is not easy. So go ahead to the next one. And then, the National Council on School Facilities, some of whom members are here, has been doing a lot of work in collaboration with Cooperative Strategies and David Sturtz and a few of the rest of us, and just put in the links to the workbooks that David, you and Mary and others put together in terms of costing, budget estimates and scenarios. And maybe you want to make a comment on where those are at in terms of how they've been updated since they were originally created. But again, I think the point is those are actually Excel downloadable worksheets that can be customized. And people trying to figure out how do you budget for these mitigation measures, right? Because you can't just do these for free. They cost time, money, and materials. And these webinars, I should add, if folks don't know, all of these webinars that David and the National Council have been hosting since back in, I think, May or April, are all online and viewable. So go to the next slide unless you want to make a comment on these, David.
No, that's fine. I appreciate it. Yeah, they are on our website. We've got everything up on our website under publications. I think Mary has a lot on the National Council website as well. And we're actually redoing the site here because in the next few weeks, we'll have a topical organization of everything we've talked about. We've gone out for the first few months and cropped the webinars with all these interviews topically based upon what we've been, HVAC or capacity or whatever it is. And so we can have some more shorter snippets available here shortly based upon what you're looking for. Okay.
Yeah, and I think that, someone, Leanne Dillon asked a question about factoring in wearing masks. What I've noticed in a lot of these calculators, or at least some of them, is that you can put in that as a factor, like all children or only adults or everybody or no one. And on a couple of them, it changes your risk output, as it relates to that. So yeah, I mean, those things are definitely being built in. And then if folks haven't seen, we're trying to, a lot of places are trying to move outdoors. Really difficult here in this inferno of smoke that we're in California. But some of the folks doing really good work on this is led by Green Schoolyards America and Sharon Danks, who, working with scientists at Berkeley and some school districts and others, putting together resources, guides, even listing out, what are the shade structures that one could buy that are the state will give their okay in terms of their strength and whatnot. But they've been putting together examples. They've been hosting workshops, and they have a pilot cohort of school districts, I think most of whom are in California, but perhaps not exclusively, but really giving a lot of ideas on design as well as how you tie that into outdoor education with the regular curriculum. So really solid work here that is obviously ongoing. Next one. So, I do a lot of work on state level policy, and I would love to be pointed to other state level guidance that is specific to facilities. One of the very few that I've seen is Rhode Island, which just came out with a new one. And it incorporates a lot of what we've talked about here. And full disclosure, I did give them feedback on an initial draft. But one of the things I was really struck by in it, which differentiates it from, I think, some of the approach here in my own state of California, is the guiding principles, which is, I think layering defenses, that is masks, ventilation, spacing, cleaning, etc. Everybody knows that. But a real focus on knowing your facilities. You have to assess what's going on, whether it's the size or the ventilation rates or the CO2, whatever that is. But they made a point about shared responsibility, which I think gets at costs from the state to the local level, which is there's a different culture in different states. I thought they did a good job. I would love to see other states that have done facility specific, that is stuff other than just cleaning and even maybe distancing so much. But I thought theirs was interesting and useful. It just came out a handful of days ago. Go on to the next one. I think we're about done. Okay, so believe it or not, a lot of this information is evolving and being communicated every day on Twitter. And I don't know how many of you are on Twitter. I'm not suggesting I enjoy being on Twitter, but that is where the leading scientists on the transmission of this virus are communicating with each other and collaborating, posting webinars, posting pictures, some of which I've had in this discussion, giving very detailed, like multi-string threads of here's what schools should do, really phenomenal work that is happening so fast, and they're responding in real time to questions. Like I would pose to Lindsay Marr this question of, and I'm actually sure she's already answered it, go back, yeah, is this question of the resuspension of floor virus, would that be any different than the flu? She would know that immediately, and I'm sure she's already tweeted about it. In fact, I know that she has. I will look it up. These are
Go ahead
6
and
or
step on
7
the brake and let me back up.
leading folks who are on Twitter every day, collaborating all the time. And most of these folks, I've pointed to their work already, but these are the folks who are really influencing the field and really putting together exactly what's the air exchange rate that would give you ideal versus somewhat risky versus very poor, etc. They've kind of become rock stars, if you will. You've probably read some of their stuff in Time or NPR interviews or whatnot, but these are my go-tos every single day, and it's pretty remarkable. They were some of the lead authors on that paper or letter to the WHO. Keep going. So Lindsay Marr at Virginia Tech, who is probably one of the leading people in the world who understands aerosols and viruses, and who probably never wanted to have her work needed so badly. She literally posted this the other day, trying to help folks understand the difference of these transmission routes with no interventions, that is no masks, no spacing, etc., compared to all interventions. And it's hard to see actually the smallness of the particles in this graphic. Maybe that's symbolic of them not being able to be seen in real life. But it very clearly shows the relationship between like risk management and the different interventions, right? Obviously, I mean, the science is clear on masks. They are very effective. But this is an example. This is not in a paper. She posted this on Twitter, 2 or 3 days ago. I'm sure we'll be in a paper at some point, but that process of publishing, and they're doing peer review, obviously, but a lot of stuff is coming out in preprint that's pre-peer reviewed, like in the peer review process, because the need is so urgent. So anyway, go to the next slide and we're almost done. Yeah, so here is our website, there's a big thing right on the front to get you to this list of resources, which we are compiling and adding to each day. Although I'm trying to be, I think what we're all suffering from is information overload and fire hoses in the face. And I'm really trying to limit it to, you know, stuff that's kind of new and unique, that is very facility specific, and particularly that is tools. It's not just framing or whatnot, but there's sort of usable tools. And so you can email me, you could tag us on Twitter, and we'll be watching all of that. But that's where that lives. And I think that's the last slide, David, if I remember right.
Yeah.
Okay. But anyway,
yeah,
I would love to
great.
hear questions, or I don't know that I'll be able to answer them, but I would love to hear folks flag other things that complement what we're seeing here, or if someone has used one of these and benefited from it.
Well, yeah, Jeff, I would just go right out of the chute and say, you know, when we spoke with Dr. Myers from UT about, you know, her work, and it was very much preventing the virus to get inside the building. Like that's her expertise. And she provided us a very elegant formula that we can use to plug in, you know, what's your rate of community spread, how big are your schools, here's your little formula, plug it in, and there's your risk factor, right? And it's like so step one. Step two, how do you mitigate it in? And it's like, that's all of this. This is all keeping it from spreading around. You take hers, which is keeping it from getting in, then you keep it from spreading around. That's your 1-2 punch that we've been missing, syncing together, I think. For what it's worth. And that webinar, you can find it on YouTube, and that was, what, 2 weeks ago. That's also on the website. So I don't want to monopolize questions. Does anybody have comments, questions that they didn't yet post in the chat for Jeff that you wanted to bring? Just go ahead. We're a small enough group today. Just go ahead and unmute if you'd like.
And maybe you want to go back to the Twitter handles of these rock star virus scientists. If folks are, I mean, it's quite remarkable, actually, how much work these folks are doing.
Yeah. I'd say, and just folks interrupt me if a question comes to mind, the calculator on air exchange per, you know, in a room, that is huge. That's something that a lot of folks have been looking for. And then the guidance for how to commission, you know, your system to make sure that your HVAC system, to make sure that's working, because there's been this evolution of thought, as you said, that this is what we need to deal with, but how? How do I deal with it? How do I prioritize my repairs? How do I determine whether or not I have enough circulation? And one would assume, Jeff, and correct me if I'm saying this too simply, but if you have a room and you plug in your size of the room and the air exchange rates, and it's below that acceptable threshold, like that's not a classroom you want to use. Like that's nuts and bolts where condition impacts your ability to open. Or am I saying that right? Or is that too simple?
I mean, yeah, I haven't seen this in practice, but I have heard of, maybe somebody knows, maybe this was in New York, I don't know. I saw a passing thing about a proposal about a daily or weekly kind of air quality analysis or check. I don't know if it was just CO2, might have been the CO2, because that's the quickest thing, as a proxy for air exchange. But that, you know, just like restaurants have, you know, cleanliness seals, that would have the same thing, but obviously that has to be, you know, done on a daily or weekly or daily basis, ideally. But, you know, I would be curious if folks if anyone on here has discussed doing something like that, either formally or informally. And if parents are, and related to that, I'm very curious what parent demand for HVAC and air exchange, you know, what they're seeing.
I know we've had folks in state, Amy Clark from New Hampshire, several months ago was talking about having a significant number of survey results. I'm not sure if that part of the question I can ask her. If anybody's familiar with any kind of surveys that you put out that speak to air quality and perceptions of it, or data on it, please unmute and share or post in the chat. Jim Effie on the chat asked about these ventilation rates. Jim, I'm assuming this is the slide you're talking about. Probably assume no open doors or windows. And it does look like we have a step in here to account for some outdoor air ventilation, but that would be, I think, Jeff, correct me if I'm wrong, that would be targeted or planned ventilation, not sort of cracks in windows and miscellaneous.
Yeah, what I've seen, I think, on these is that if you knew the exact enumeration, you can put it in, but if you don't, you can make an estimate of, high, medium, low, or some scale like that, which I think is a good approach, because we don't always know, and we don't always have the time or resources to actually figure out what that air exchange rate is. But we may be able to make an assumption that this one has low or medium. Are you at risk of not being right? Well, absolutely. But you're doing, you're doing something as opposed to doing nothing, I guess.
Yeah.
Dave, this is Guy. On those, on the question about parental, we're seeing most of that being driven through school boards. Idaho is unique in that, we have like 187 unique school boards or governance areas, but what we're seeing is twofold. We're seeing a cry for just slapping in much higher filtration into the current HVAC system, and we talked about the potential problems that brings up. And the other one is let's leave all the windows and doors open, which from my perspective cause an intense amount of security risk, but also screw the balance in air exchange up horribly. So we're seeing that, and most of it's being done by people who don't understand building HVAC. The answer is the quick answer is more air and more filtration.
Mm-hmm.
So it's how we're trying to work to educate people as to what those two things, what those two simple statements mean from an operational standpoint.
Right.
I think you should take a look, Guy, at that video that the UC Davis folks did on ventilation, because I think that it actually talks a little bit about, if I remember right, the challenge, like you can't just like slap in another filter, because the system, maybe it won't fit, or the system has to work harder. It talks a little bit about that in an easy to understand perspective, and the balance, if I remember right.
That's this one, Jeff? This
yeah.
little image here. Yeah.
It'll be on our website tomorrow.
Awesome.
Good.
Yeah. And there's a great webinar. We had spoke with a facilities director at Colorado Springs, District 11, about a month ago, a little more so, who did an extensive study of their systems and great step-by-step process of what to look for from a hardware software perspective on your HVAC, and then a reasonable planning within budget. And they couldn't do anything more than MERV 8. That's what we got. Our systems are too old. I got $750,000 in deficiencies that I identified. That's my entire budget. That's all I can do. And we're sticking with MERV 8. We're optimizing our system and doubling the fresh air. But we can't do more than that, or we're going to run the system too hot. So great sort of brass tacks what you can do with limited resources. And they're a 4 high school district, or a decent sized district. I think, Rob, your comment, I believe an assumption has to be made that filter maintenance and changing has to happen more frequently due to an increase in air exchange in the building. Yeah, that passes the sniff test. No HVAC technician, Jeff, but that seems what I've heard as well. You run the system hot, it's going to have to turn it over and repair it more.
Yeah, it'd be interesting to see what manufacturers say in regards to some of that. But, you know, the standard from where I was in superintendent is we were looking at a monthly change out of those filters. But with the increase in exchange, I assume that has to happen more frequently, which obviously your maintenance budget's going to increase as well.
Right. Well, Jeff, these resources are great. User-friendly, downloadable. That's perfect. Really appreciate you
maybe
putting
go
this together
back to the
for
last
us.
one. Go back to the last one with the URL so folks have it. Please send me, you know, point me to more. I'll do what I can to share or find it. You know, and I'll inquire about that flu question about kick up from the floor. See what I can.
Yeah.
Come up with.
You know, not to go too off topic here, Jeff, but it, you know, seems like really once this thing becomes just part of, you know, our world, and we get a vaccine and it becomes another virus we're dealing with, it's not going to just disappear. All of, you know, we were hyper focused on this, but some of these like filter changes and cleaning changes and hygiene changes are going to, it seems like they're going to have to bake in some level of that for the new normal, not the current sort of hyper mode, but some level of that. And HVAC repair, just seeing the conditions of schools that I've been in and know clients I worked with, like that seems like target number one out there.
Yeah, you know, I often, as I'm, you know, feeling miserable about everything, I try to think about what might be a few silver linings here going forward. And maybe I'm naive, but if a silver lining, you know, 5-6 years from now, a new normal was, you know, on average, cleaner classrooms and cleaner schools, on average, better indoor air quality at schools across this country, and on average, smaller class sizes, those would probably be good things, I would think. So
yeah, let's kind of end with this, Jeff. You know, maybe you can tell folks a little bit about the annual State of the Schools report that you and Mary and others work on, and maybe if they're not familiar with that, and then, you know, sort of our discussion that we've been having about making school condition needs a more part of the public conversation, sure, as it pertains to this virus, but beyond that.
Sure. If folks aren't aware, we have a national coalition of public sector, nonprofit, academic, industry folks, and nonprofit folks, if I said that, who have been advocating for a number of years now, kind of formally, for federal funds to modernize school facilities. And, you know, the House passed the Reopen and Rebuild America School Act, RASA with 2 R's at the beginning, which, you know, we provided good input into that bill, and it's got some good stuff in it. We have been hoping that this would be part of school, the federal stimulus would be, you know, whether it's targeted around HVAC or modernization in general. You know, our belief has been that, you know, this infrastructure, as we call it, because it is infrastructure, school facilities is so important to our local community health and national health and performance that, you know, it begs a role for the state, not a huge role, but a role in collaboration with states, or for the feds rather, a role for the feds in collaboration with states and local school districts that are, you know, by and large, you know, doing the most of that heavy lifting. But we've been enumerating every few years kind of what's being invested on capital and maintenance and operations by state and nationally, to try to understand where the gaps are in spending and what we think should be spent relative to the amount of square foot. And the State of Our Schools report, if you look that up, was last done in 2016. We're hoping to redo it perhaps later this year if possible. But anyway, making the case that, we're sort of in a chronic pattern of underinvestment in this infrastructure in too many communities over time. I mean, that's certainly true in communities in California. We have no state money for school facilities at all in California. We're hoping to get this, this bill that's on the governor's desk for HVAC funds may or may not happen. We'll see. But anyway, it's part of a larger conversation about raising awareness of the needs for upgrades in schools, which was needed pre-COVID, but now I think is even more visceral to folks in a COVID world. But the website for our coalition, if you haven't signed on to it, please take a look at it and consider doing so with your organization. It's buildusschools.org. You can find all the data on the spending, national spending. There's a rollover map and everything. And you can find info on the federal legislation that has been introduced. And actually, I just learned 5 minutes before this call that and someone could probably correct me, but the stimulus bill is not moving forward from the Hill as of an hour ago.
Is not moving. This is the email PowerPoint that Mary, who's still recovering from hip replacement surgery, so wish her well, sent us just moments before. And that's what this looks like, Jeff, that we're still at gridlock.
I think McConnell and the Republicans introduced a slimmer package that was not accepted by the Dems, and so I think they're still at a stalemate. So it really remains to be seen what's going to happen.
Yeah, here it is. Here's her brief snippet. Senate did not pass the skinny cares, so we're back at ground zero. So
yeah.
Okay, so there's the website, buildusschools.org.
Yeah.
And so right now, the position of BASIC is advocating for $10 billion in emergency repairs, but that's part of a larger, we need to rebuild our schools. Kind of likened it to a space race for a generation, kind of national mobilization. I don't know, many of the clients I work with just financially can't do it. You got most of your portfolio is beyond useful life and all local funds, and the math just doesn't work.
Well, and part of our case for a federal role has been that if you look at education funding, program funding, the federal government does about 10% of all funding, right? The operations funding goes to pay teachers, et cetera. They do, less than 1% on the capital facility side, and most of that is through FEMA. And our argument has been there should be parity on both the operating and the capital side from the feds. And so on BASIC website there, you'll see you'll see some documentation of a much more articulate and well-cited argument around that, which you can certainly cherry pick from, but take a look at it.
Okay. Well, appreciate that, Jeff. We are at time for today. Unless somebody had any further comments, feel free to interrupt me as we do. But this conversation about, mobilizing around the need for investments in schools, certainly something that we all have a vested interest in continuing. And as we stabilize, hopefully a little bit this fall, we'll continue that conversation and look at bringing something actionable and meaningful. Jeff, anybody else on the call, closing thoughts? Well, check out the website.
Thank you. Email
folks.
me. Yeah, email me resources. Happy to point you in directions on things. I've seen a lot, so I've been trying to, see what's going on out there. This seems to be the best of the best, but I'm sure I'm missing something. So, feel free to email me questions or other resources.
Well, everybody, thank Jeff on your way out. Have a great day. Thanks for coming, everybody, to our weekly conversation. Look forward to talking to you next week. Have a great rest of your day. Jeff, thanks again for everything.